Hey, it's Larry with more ramblings after the 10th day of prostate cancer surgery. In my home now, convalescing. If you've been seeing or listening of any of my previous videos, you would know I'm about 10 days after surgery. And I've been trying to be as fair and reasonable and straightforward as it happens about what has been happening to me from the get-go. My feelings, my reactions from the heart. Today I got to thinking a lot this afternoon about mental aspects of prostate surgery. So far it's been pretty much the mechanical part, the biological part, and what we deal with as a man afterwards, which I think is important. I think every man should know, kind of have maybe an idea in mind about what to expect. And once again, results may vary. It is obviously different, mostly for every man, to do agree, but there are some basics, and I've tried to share those with you. And I've not pulled any punches. I've not tried to be just outrageously crazy about everything. But this I'd like to talk to you about, and really not so much to the prostate patient, but their partner. If you are living with, caring for, loving a man, and you're in a relationship with a man that is going through this or about to go through this, I'd kind of like to speak to you about maybe some things that might help you while you're with that man during this process. Now, right up the bat, I'll tell you, I live alone. I'm divorced 20 years. I still have a very close relationship with my ex. But being alone for 20 years, except for my fur babies, my German Shepherd and my little bad bulldog, I'm a very social creature. I do get out on the weekends. I have a little sideline job that allows me to spend several hours out in the public because I like meeting new people, and that's my social release, doing that. That's all going to be taken away for a while, and I get that. It's not hopefully be permanent. I don't even think it will be close to being permanent, but it's going to be gone for a while. So, but you're with someone that's dealing with it 24/7. And listen, particularly if your mate is an alpha male. I'm one. I wear that badge proudly. I've always been proud and wore the badge of masculinity, not to the point that, as they say, toxic masculinity. I'm sorry, I don't buy into that. A man is a man, and most men enjoy being a man and all that it encompasses. That's in our genetic code. I started as early as, a teenager going, yeah, I'm a man. I got muscles. I can run faster. I'm stronger. This is physical. But as you age and mature, a lot of that goes away. And hey, me and my friend who's the same age used to actually laugh. And I listen, I'm saying this with guilt that I did this and he did this. We used to make fun of those commercials. Help! I've fallen and I can't get up. I mean, everybody's seen those commercials. We used to actually say, well, stop whining and get up. Well, it hit me about 5 years ago. I actually got down on the floor to do some work under my sink because I'm a Mr. Fix-It. I don't call the plumber. I get under there, I'll take the trap off, or if there's a leak, I take the supply lines loose, turn the water off, take the supply lines loose, stop the leak, get a new whatever it needs. And when I went to climb out and get up after being under there, for probably 30 minutes, I couldn't. I mean, literally, I had to roll around and find a certain position where I could get maybe one knee under me, and then roll around and get on an elbow where I can push up here. I mean, really? And the first thing that went through my mind was that commercial that I remember seeing where I'd made fun of the man that was saying, help, I've fallen and I can't get up. Because although I hadn't fallen, I was having a heck of a time getting up. Now, I did eventually get up. I didn't have to push the little button, life alert, whatever, and have them come help me get up, fire department. But it's when it hit me like, wow, this is a part of getting old. For an alpha male, and I don't care how tough and rough you are, the day will come where the flexibility and the muscular physique that we have begins to dwindle. It's just a fact of life. So now, to make all of that even worse, particularly being an alpha male, I'm relating it my point of view. Every man is not that way. And this is not for every man or the mate of that man. But try to understand this as he goes through this. He's going to have periods where he feels like a lot of that masculinity has just been cut and sucked out of him, that gland. And listen, there are things that happen that you can't do or control anymore that relate to being a masculine male. And of course, the first thing that comes to most men's mind, maybe not the first, but it probably will at some point be up there on the top of the list, is this the end of my sex life? What is my partner going to think of me? Am I going to be less of a man in their mind? Listen, that's important to a man. That's who we are. That's part of our being here on the planet. So all of a sudden he has to think about that, and he is going to probably have days where he thinks about it more, and it's going to probably, or possibly, I say possibly, results may vary, it possibly may depress him. You may see days where he's just kind of sitting there staring off into space and thinking about those things, and it can be depressing. Now, the medical people, the surgeons, the doctors that know this, they will tell you, well, we're very careful going in there. We're going to try not to cut this nerve that equates to the penis and the erections working properly. And I think in most cases they're probably pretty good at that. But hey, there may be some trauma even if they don't really damage it. And it's probably not going to work well for a while. And they tell you that up front. But when you're actually going through it as the patient, I mean, you can read about it all day and be told about it, but until it's not working, and it always has in the past, and if you and that man has had a great sex life together, and all of a sudden that's gone from him and you, things are different. I was married for a long time. I know the relationship between a man and a woman, the ebb and the flow, and the give and the take. And if those two people are really working at making that relationship happen and continue, because there's lots of different phases as we go through that as we age. As you become more mature and older, you realize that it's not all about lust anymore. It's about love and caring and empathy and working with that person and appreciating that person. So try to appreciate that man. He's still a man. He still has the same heart, still has the same soul that you've learned and loved, and that's why you're with him. He just had a part of his sexuality taken away from him. Now, it may be temporary. It may come roaring back like a lion in the spring. Hey, I actually talked to a man for about 6 months afterwards. He said his was better than ever. Hey, God bless him. I don't really dwell on that too much because I am alone. I don't have a partner, and I probably spend the rest of my life that way. I've never been out the one to go to bars and chase around, and I've had a few relationships after my marriage, but nothing that's stuck. Hey, at this age, it's difficult to find someone that you can relate to. But anyway, I digress. Back to your feelings and what you may feel being with that man as he goes through this. All I can say is try to be understanding. Okay? That's a no-brainer. Try to be patient with that man. Try to be encouraging to that man. And you know what? If he soaks the bed sheets, if he has an oops in the bathroom, it's not his fault. He feels bad enough when that happens. Just say, it's okay. I got this. We'll get through it together. let him really understand that you understand and that you're going to stand with him. And don't make him feel like he's less of a man because this has happened, because he's already having all those feelings. I mean, seriously, that's part of who we are. So, as they say, this too shall pass. But stay strong with him. Let him know that you're by his side and that you will. That's golden. That means a lot. That's better than any magical pill or any magical therapy that a physician or a doctor or surgeon or anybody in the medical industry can impart upon him. You be his supporter and let him lean on you. That's not to say that, you're supposed to baby him. Most men don't like to be babied. Well, let me back the truck up. Let me just say this. There is an element in, I think, most men where, when we had a good mother that petted us and rubbed on us and loved us and held us and rubbed our knee when we fell and skinted and kissed us and made us feel better. That's kind of in the back of our mind, subconsciously. We kind of like being with a woman that will make us feel that way. Now, she doesn't have to baby us. I don't mean that. You don't have to say to him, oh, you poor thing, I'm so sorry. No, that's not what he wants. That's not what he needs. He needs to see your love and support and understanding. If you can handle that for him, that's your role. I think that's all you got to do. Well, I don't even say role. You don't have a role. You just have a relationship with this man, and if you let him know you're there and you're going to support him, I'm repeating myself. I think it'll go far to help him get through this, because I think every day will be better unless something happens to backtrack. But I'm finding with me, I'm 10 days out, and I tell people when they text me, I get lots of friends every day, hey, how are you doing this morning? I say, I'm better today than I was yesterday, and I think I'll be better tomorrow than I am today. And you can help him arrive at that mindset. It'll work good for both of you. So, more ramblings by Larry. Ooh, I feel like I'm not talking well today. I promise there's no chemicals doing that. It's late in the afternoon. I'm a little tired. I went down, by the way, for the first time today. I walked out of my house, out into the sunshine, walked to the front mailbox, went back into the garden, picked 6 or 7 tomatoes, dug a few potatoes, went out to the back where the chickens are, threw them some feed, talked to them a little bit. Yes, I do. I call my chickens, they come running. Played with my dogs just a little outside, about 45 minutes. Thinking all the time, I need this, but I'm not going to overdo it. Went back up the stairs. I live upstairs. And when I got upstairs, 45 minutes of that, it just totally exhausted me. I was shocked, because in the process of doing all that, I was not hurting. I was not winded. I mean, I was walking slow and I was being careful and remembering, I don't pick up anything over 10 pounds. I had to check myself up quick a couple times on that. But anyway, when I got back in there, I was like, whoa, let me in my chair. I'm exhausted. And I went into a 2-hour deep nap. I'm in my phase of life where naps are good in the afternoon. I don't make apologies for them. I like them. The body heals itself when you're sleeping. That's why we all need good night's sleep, uninterrupted sleep. The body can fix a lot of things while you're laying there in alpha waves, deep sleep, as they say, REM sleep. A rapid eye movement. I think that's what that stands for. Maybe it's not even alpha. All I know is you need deep, uninterrupted sleep. So here again, I'm babbling. It's what I do best. But back to your partner. Just treat him with dignity. He's going to feel bad when he does the oops. He's going to feel bad when he misses the toilet, or he's going to feel bad when he has to climb into a pair of it depends. Okay? A man doesn't like seeing himself in the mirror wearing Depends. Understand that about him. Don't make fun of him. Don't laugh and go, whoa. Unless you guys both have a good sense of humor and you can say, well, maybe you could be a male model for the Depends commercial. Hey, if you think you can deal with that and that helps, go down the road of humor. But don't make him feel bad about now that he's wearing Depends, because like I said the other day, I think it's the best technology since the discovery of the wheel. And believe me, when I put them on and saw myself in the mirror, I went, oh, me. This is right in there with going, help, I've fallen and I can't get up. But, we're resilient as humans, and particularly if you're a good, strong male, you have to adapt, and we'll adapt. You try to adapt with him. I'm talking to you, the partner. Adapt with that man, and it'll all going to work out. Y'all hang together, be a team together, and get through this. I'm going to shut up. I'll see you again next time. Thank you.